Good evening, everyone. I'm Dr. Sumanth from Sri Ramachandra Center for Sports Science. So I'll be presenting my paper on paralabral cysts in cricketers, a case series. So brief introduction about paralabral cysts of shoulder. Paralabral cysts usually develops when there is a labral or a capsular tear, and this allows synovial fluid into the tissues, creating a one valve effect. So it is most common among the posterior, superior, and anterior labrum, and it is uncommon inferiorly to the joint. The cyst usually varies in size, and it consists of one or multiple locules, and it is most common in males, and it is common during the second to third decade of life. So the mechanism of injury, paralabral cysts are usually associated with labral tears, and it is most common in bowlers and fielders during the late cocking phase at maximum external rotation. So these paralabral cysts usually cause compression of the suprascapular nerve, and this in turn results in atrophy of the supraspinatus and infraspinatus muscle. So methods and materials. The study was done at Sri Ramachandra Center for Sports Science, and it was done between 2019 to 2023 on a sample size of 12, and the level of playing was local league male cricketers, and the outcome score used here was quick dash score, where 0 indicates no disability and 100 indicates severe disability. So the main case findings here are most common complaints are shoulder pain and instability, and the mechanism of injury is usually continuous overhead activities, and on inspection we usually find supraspinatus or infraspinatus wasting. And the positive special tests are O'Brien's test for slap tear, apprehension test for Bankard's lesion, and jerk test for posterior labral tears. So this was the MRI of a 27-year-old. So as we can see in all these sections, we can see a posterior labral tear associated with a paralabral cyst. So the surgical technique used here was paralabral cyst decompression plus labral repair. So here we can see the arthroscopic surgery done here. So in the first image, we can see the posterior labral tear through which we enter the paralabral cyst, and the paralabral cyst is decompressed in the second image, and in the third image this posterior labrum is repaired with suture anchors. So post-operative rehab, so we usually start the patients on broad arm sling for a period of 1 month, and in the first 1 to 2 days we start fist pump exercises, active elbow movements, and after suture removal we start shoulder isometric exercises, and after 1 month we wean off the broad arm sling and start Codman's pendular exercises, and after 6 weeks we start wall climber exercises to improve the range of motion, and at 2 months we start scapular stabilization exercises, and by the end of 3 months these patients should have a full range of motion, and we start isotonic exercises then, and at 4 months we start shoulder proprioception and plyometric exercises. So the results of my study, all the patients reported for follow-up here, and there were no recurrence of symptoms, and the mean quick dash score pre-operatively taken was 38.6%, and after surgery 6 months after follow-up the mean quick dash score was 2.3%. So all the cases had an excellent functional recovery according to quick dash score. So discussion, according to Piat et al., the rate of concomitant presence of slap lesion and paralabral cyst was found to be around 89%. So if typical slap lesions are not observed, it usually exists as a fissure at the posterior part of the labrum. So in this study, most of the cases seen were slap lesions, and in about 4 cases, posterior labral tears were seen. One-way valve mechanism usually induces formation of cysts at the spinoglenoid notch. So closing the valve and suturing the labrum is the most effective method of cyst resolution and pain elimination. So according to Schroeder et al., simple slap repair was done to close the valve, and according to Piat et al., it was better to do a cyst decompression along with labral repair. In this study, we have done a cyst decompression before repairing the labrum, and there were no recurrences of the cyst after follow-up. So conclusion of the study, arthroscopic cyst decompression with labral repair along with a criteria-based rehab program helps in improving the functional outcome of cricketers. These are my references. Thank you.